if you want to do a soft tissue fixation of quadriceps on both the sides and you have not taken any bony plugs, then with Osteocare you have an option to prepare both the femoral and the tibial sides using specialized quadriceps button. Here on the left hand side we can see the Eco button flex with the quad option available. So this is a regular Eco button flex and this has a addendum to that which can be used for the quadricep fixation. And on the tibial side we have an option of either peak button or titanium button along with an adjustable loop along with an quadriceps adjustment button. So we can do this fixation, these buttons both. So we have buttons for both femur and tibia, and these buttons, usually both of these buttons come with a needle, and this straight needle is very useful for preparation of the graft. Some of you can hold this graft on this side, and you can hold the graft on this side. Okay, so when we are using it on here like this, you have to keep the button at this position, and these buttons come with a needle. The needle is seen here, and what we need to do is we need to pass this needle through the graft like this, and we need to prepare at least about 20 millimeters, about 2 centimeter of the graft like this. So what I do is I pierce this needle like this down, take it like this. Okay, this is passed like this, and then this is passed like this. Okay, you have to adjust it at the place, so the quadriceps band or the quadriceps tape should rest here. After that, I will ask my assistant to just leave it. We'll come over it, and this needle will now be passed over the quadriceps tape in this fashion like this. Okay, and then we pull it back again like this. Again we go round on the side, take the needle and pass it through the tape on the other side. So we keep on passing this way, and we will have a good weaved area of the quadricep which is prepared. So again we go on like this, leave it from here, hold it again, and again we have to pass the needle like this. So this way we are able to prepare the graft in a very solid fashion. So you can see the quadriceps graft is prepared very nicely on the soft tissue quadriceps tendon. Once we are done with that, the final suture, we pass it from here like this. Again we tie it thoroughly, and once you tie it, you can see that everything is. So this is finally what we see. This is how we prepare the graft. Again the final call again, like this. Okay, so once we are done with that, okay, so this is how the tape is prepared. You can see that the quadriceps is prepared very nicely along with the button. So you can use a smaller button, you can use a 15 mm button, or you can use an adjustable button with the option is given, and the quadriceps tape is seated very nicely along with that. So if you appreciate, this is the quadriceps tape, and this sits very nicely flush with the button here, and this will give you a very nice fixation. Please hold it here, and in the end what we will do is we will just cut this needle like this, and then we will tie this on both the sides like this. So this gives rise to a very strong fixation on the femoral side. So this is the quadriceps femoral fixation. The tibial fixation is similar. So again we have to put it here in this area. Again hold it like this. Again the tape will be attached with this. So the tape again, so this is on the tibial side preparation. The tape is again attached to the button. So you just put it down like this. Okay, hold it like this. Okay, and then just leave it totally, leave anything. this goes over and above the passing, and then we use our, so you can see this is the tape into its place. Okay, this is the tape into its place. Okay, and you can see that the cordyceps tape is here. So I'll use my needle to pass it through the tape. It goes like this. When we pull it, both the sides will lock the tape perfectly onto its place. You can see both the sides have locked the tape into its place. Again, we take the needle out like this and pass the needle like this from the tape. Okay, so again when you pull it, the tape will actually, you have to keep. Okay, so again when you tie it, it is tying the tape normally. Again you have to pass the cordyceps button into this loop again once more, and then the needle is again passed into the cordyceps loop like this. Okay, so when you pull it, whole of the system is catched. So what you can appreciate is that we have done a very nice whip stitch configuration of the cordyceps tape along with that. So on both the sides the cordyceps tape is there, and using the straight needle with two sutures we are able to repair it nicely. And in the end again we will just cut it, and then we pass this on both the sides of the tape of the cordyceps and tie it like this. So this leads to a very good soft tissue fixation of the cordyceps graft onto the button. So we have multiple options of the cordyceps devices which are available in the family. So we have a cordyceps button for the tibia, we have the cordyceps button for the femur, and this gives you a very nice construct in a whip stitch fashion, and you can use these adjustable loops on both the sides to tension the quadriceps graft into your knee. So at present this is one of my favorite techniques to do an ACL reconstruction. Using a quadriceps will reduce your re-tear rates and the stability. It will also reduce the chances of the late laxity that may happen with the hamstring graft. Sometimes there are some limitations, some side effects of the quadriceps graft as well, but in my view, using this technique, if you use quadriceps graft for a long time duration, I think the results are going to be very good, and overall we could be able to give a little better results to the patients than the hamstring graft. Please feel free to contact us for any more details regarding the quadriceps graft. Thank you.